Have you ever wondered if your neck is causing your dizziness? In today's video, we are going to talk about how to know if you have cervicogenic dizziness or neck-related dizziness. For those of you who don't know me, my name is Amy McMillin. I own a concierge physical therapy company, Custom Care Rehab, in Northeast Ohio, and I am a mobile vestibular therapist in Northeast Ohio. I have this channel to give you tips and tricks on how to treat your dizziness at home, no matter where you live. I have many patients who comment and ask me, how do I know if my neck is involved? Could my neck be causing my dizziness? A lot of times the answer is yes. I see a lot of vestibular patients that maybe it starts off with a stroke or a central reason or an inner ear reason that they're having dizziness. And then the neck guards up, kind of protects against that dizziness, and you can develop a layer of cervicogenic dizziness on top. And sometimes it is the original cause of the dizziness. So how do you know what is what? A couple cues or descriptors that I look for when a patient describes their dizziness is if their dizziness is described as more of a floaty, swimmy feeling in the head. Number 2, if the dizziness appears to be present when they are seated and then worse when walking around. The inner ear does not commonly give you symptoms of that swimminess if you're not activating it. So if you are still, the inner ear's not activated, and if you still have dizziness, I kind of am leaning towards that being in the cervicogenic column, at least a possibility. Number 3, no hearing loss. Cervicogenic dizziness does not involve hearing at all. So you would have a normal hearing when you do the finger rub test to the ear and audiology exam. Number 4, you can have ear fullness or ringing that seems to increase when you move your neck, but you don't have other symptoms of Meniere's or migraines like light sensitivity, sound sensitivity, smell sensitivity. You don't have hearing loss. It seems to fluctuate based on you moving your neck. Number 5 that I look for is if you get dizzy when you move your head slow versus fast. You activate the inner ear whenever you move the head fast. But if you move it slow, that is not activating the inner ear, it's just targeting the neck. So if you get dizzy when you move your head slow as well as fast, I put that also in the possibility of cervicogenic dizziness. So when you put all these things together, those are the things that I listen for from a patient. It tends to be more of a rocking, not spinning. It tends to be present when you're seated and walking around. You don't have hearing loss, but you can have fullness and ringing that seems to fluctuate when you move your head. And then lastly, you have more floatiness, dizziness, when you move your head slow and fast. Now, when I put all those puzzle pieces together and I wonder if the neck is actually causing dizziness, I'll do what's called a traction test to be sure. So what we'll do is do a lift of the head. I'll kind of put my hands underneath the ears. I'll lift up and take some of that pressure off of the spine. And if the client tells me they get relief from their dizziness, that lightheadedness goes away, and then I set their weight back on their spine and their dizziness starts to come back a little bit, then I am leaning towards the neck being involved. So what do I do for treatment? An X-ray is not going to tell you, an MRI is not going to tell you. You have to kind of have a therapist or a massage therapist, chiropractor, somebody start to massage those muscles and do light mobility, like spinal mobility of the joints. I'm not talking the cracking or my neck is out of alignment. Everybody's neck is out of alignment in one way or the other. You have to get hands on you, stretching, hot packs, deep tissue kind of work in these areas. Suboccipitals, base of the skull, SCM, right here, that muscle that kind of sticks out when you turn your head, and then your upper trap. Those 3 are the 3 muscles that I work on. I normally do deep tissue work, maybe even some cupping and stretching while a patient is on my table for about 30 minutes. And when they get up, they might feel a little lightheaded from the position change, but I get a lot of patients that describe they feel a little euphoric or a little high, kind of spacey. That is completely normal. And after about 10 minutes, maybe even quicker, that spaciness resolves, and all of a sudden that swimminess, that feeling is gone or better. That is my way to kind of diagnose or hypothesize that you're having cervicogenic dizziness. There is no one test or diagnostic that'll tell you if you have cervicogenic dizziness. It's more of a triad. It's listening to the client, seeing if you have those symptoms that match up with the presentation, doing a traction test where you lift the spine and decompress those nerves and see if you get relief. And then third is to actually get some hands-on palpation, release those muscles, and see if you actually do get improvement. If you are having a response to that and relief, you have a cervicogenic component, and you need to watch this playlist on the stretches that you need to do to help yourself at home. If you have any comments or questions, drop them below. And until I see you next week, stay steady, stay healthy, and stay strong.